Hi guys, welcome to this video. Those of you who watched, liked or subscribed in the last video, I'd like to thank you all for that and showing support to the channel. I greatly appreciate that. In this video, we're going to be looking at some lower back pain, or specifically non-specific lower back pain. Yeah, enjoy the video. So in this video, we're going to be discussing some non-specific lower back pain. The video is going to be divided into 4 main parts, which are going to be labelled on the screen right now. And that's going to be what the core of this video is going to focus on, with some additional facts thrown in there. And that's what we're going to start off with in just a couple of moments. Remember guys, this video is for educational purposes only. It is not medical advice. If you are in need of medical advice, please seek professional help from a therapist near you, so that way they can tailor their therapy sessions to suit you. This is just for educational purposes, gaining insight what it's like to go to the therapy clinic, what they're going to be looking for, what you should be prepared for. And for students, this is what you're going to be doing to your patients, what you're going to be keeping an eye out for, and stuff like that. So make sure to stay tuned to the rest of the video. So let's start off with some interesting facts about low back pain. So 80% of us at some point in our life are going to suffer with an episode of low back pain. 80% of us. The current population on Earth is 7.8 billion, and when we do 80% of that, that means 6.2 billion people on this Earth have or will suffer from low back pain throughout the course of their life. The majority of that 6.2 billion will heal within 3 months with absolutely no complications in the future. However, 50% of them people will suffer another episode of low back pain throughout the course of their life. Of that 6.2 billion people we just previously discussed, a whopping 13.8% of them will suffer with low back pain throughout the course of their life. Low back pain is the leading cause of disability in people under 45. Only 10% of patients who come in with low back pain can get an accurate diagnosis. The other 90% have non-specific low back pain, so they're referred to as somatic. So they've got pain, but there's no obvious cause, and they are usually treated as such. So now we're going to move on to some risk factors associated with low back pain. So your risk of low back pain increases up until you age 50. For men after that age, their risk then decreases. For women, this risk then increases, and for women who've given birth more than once, their risk increases even further. There's an increased risk for people who smoke. There's another reason for you to stop. Those who do manual labour and do often heavy work while bending and twisting are at an increased risk. Workers who end up working with a lot of vibration, such as those who use the hammer drills when digging up roads, are often at increased risk as well. Those of you who remain stationary throughout the day, just sitting at a desk or driving around all the time, are also at a further increased risk of low back pain. However, farmers appear to be at a lower risk of low back pain. Those who suffer from stress, anxiety and depression also appear to be at an increased risk of work-related low back pain. The paper by Tukan also revealed that chronic low back pain can be stress-related. This highlights the importance to always take into consideration the biopsychosocial model when treating patients. So now we're going to move on to some kind of red flags. So this is going to be interesting for both the patient perspective and for the therapist perspective. This will allow the patient to gain an understanding of what the therapist is looking for, and this will allow the therapist to actually know what they're looking for and the importance of it. So point number 1. So when you get into a treatment room, don't be surprised to be asked some uncomfortable and sometimes confusing questions. When you present yourself with low back pain into the clinic, the therapist should definitely ask you about your bowel and bladder dysfunction. They should also make sure that there's no numbness or funny feelings in the saddle kind of region. Your therapist will also want to assess whether you have any pins and needles in any areas in the lower limbs or buttock area. The therapist will also want to make sure that you have no troubles when walking. The therapist will also want to know if you have any history of cancer or cancer within the family. They will also want to know whether you experienced any unexplained weight loss, and they will also want to make sure that your night is not disturbed through your low back pain. All of these are perfectly normal questions. They just want to understand whether you have any underlying health conditions that needs to be referred on for further assessment. So now we're going to be moving on to the test and the test section. Once your therapist is happy with their subjective assessment, they will want to do some tests on you. Therapists will want to assess the area and the surrounding structures. Each therapist has their own way of doing things, so I'm not going to hypothesize about the exact tests they're going to perform in their exam. However, some common themes will be that they want to assess the range of motion at the area, the muscle strength of the surrounding structures. They will want to assess your posture. They will want to assess for stiffness throughout the lumbar spine. They will want to assess for any tenderness around the surrounding structures. Further to this, they will want to assess the neural tissue to see if they can find a source for your pain. So although I'm not naming any specific tests in this video, for students wanting to learn further about special tests and assessment, I will be doing a video on that shortly, involving all the special tests kind of to do with the lumbar spine. When researching for the gold standard of treatment for low back pain, I came across a literature review which consisted of the top treatments from across Europe and the US. One key theme across the US and Europe is that all the recommendations state that you must empower and reassure your patient provided you have found no red flags and no cause for concern in your assessment. Other treatments consist of soft tissue work, mobilizations, trigger points, and the use of no bed rest, as this is not recommended, so staying active is key to recovery. Due to this being on non-specific lower back pain, there is no exercise recommendations going to be featuring in this video, and there's no recommendations generally across the US and Europe, just because each person is different. Some people are going to be getting pain when going into extension, some people are going to be getting pain when going in flexion. Therefore, this is going to be key this is going to dictate how your treatment will be and the exercises used. Your therapist, when you go seek one, shall custom make an exercise regime custom to you. So overall, this video has been a brief introduction to lower back pain. For patients, this is going to give you an insight into what your therapist is going to be looking for, how you can prepare to go to your therapist appointment, and also to provide you with some key facts around occurrence and what you can actually do to minimize your risk of lower back pain by avoiding those risk factors we stated earlier, so avoiding the smoking, avoiding kind of manual labour where possible, just that kind of thing. We also wanted to take the stigma out of what you may be asked when you're going to be going to the treatment room, so get them uncomfortable questions kind of out of the way so you can prepare for them. For the patients, we hope this has been empowering and eye-opening for you on what to experience when going to the treatment room. For those studying, we hope it's opened your eyes to different ideas and concepts around lower back pain and actually helped you realise that it's not actually that complex to deal with lower back pain issues, especially when they're non-specific. It's just more about watching for them red flags when something's arisen and when to refer onwards. Remember, treatment of the lower back can be so simple, it does not have to be complex. Thank you for watching this video. Please like and subscribe. Don't forget to check out our other forms of social media, and hopefully we'll have more in-depth videos coming soon, such as a full assessment of the lower back for those studying, and yeah, hopefully we can keep producing quality content for you. But yeah, make sure to like, subscribe and check out our social medias.